My name is Lara Schmitz. I work as a physician assistant in orthopedics in the hand and upper extremity clinic. I'm going to talk to you today about carpal tunnel release surgery, reflecting on my experience in orthopedics, as well as having had carpal tunnel release surgery myself a few years ago. We've updated some of our protocols, so this is going to reflect our most current practice. Carpal tunnel release is a breeze if you know what to expect. I'm going to answer the 4 most commonly asked questions about surgery, and then we'll go into more detail about all phases of care. The first question people ask is, what's the timeline? When can I expect my care to happen? Second, will it be painful? Third, how active can I be after surgery? And fourth, when can I return to work? Carpal tunnel release is an outpatient procedure. That means you're going home the same day and no lengthy hospital stay is required. It's then followed by 2 check-ins after surgery. We call these post-op visits. We are very excited to offer virtual follow-ups for patients who elect an endoscopic carpal tunnel release with dissolvable sutures. We've had an overwhelming response from patients that this adds increased flexibility and decreases time out of work after surgery. Carpal tunnel release is a surgery, so it's not pain-free, but we find that pain is mild, manageable, and short-lived if you follow these guidelines. Most patients control their pain alternating over-the-counter Tylenol and ibuprofen. We also prescribe a stronger painkiller for any more significant pain, particularly that which is disturbing your ability to sleep the first few nights after surgery. I also recommend applying ice to the back or bottom of the hand and elevating your hand so that it's above the level of your heart, typically on a few pillows beneath the elbow. You'll also receive a numbing agent, local anesthesia, and you will return home with numbness that controls your pain in your hand and fingers temporarily. We recommend that you do begin taking your over-the-counter or prescribed pain medication before the numbing agent wears off for best pain control. This minimally invasive surgery allows you to resume activities immediately after surgery with some exceptions. No driving for 24 hours after receiving anesthesia for sedation, and no driving while you're taking the painkillers. Otherwise, all light activities less than a pound are typically very well tolerated, including reading a book or typing on a computer. For the first 3 days, you may have some difficulty with pinching or grasping activities, particularly involving the first 3 fingers. Whether you're working or retired, you'll want to protect your healing incision by avoiding prolonged or heavy pressure through the palm. Once the incision is healed, you may have some soreness and some aching with use of the hand, but you won't do any damage to the site. You need to use your hand in order to build strength. In other words, with rare exceptions for very heavy activities, you can gradually increase your activities as pain allows after 2 weeks. Most patients return to work relatively quickly after surgery. If you have a supervisory role, work from home, or perform light office duties, you'll likely feel well enough to return 4 to 7 days after surgery. That gives you a few days to keep the dressing clean and dry and to ice and elevate your hand, ensuring that the wound heals without contamination. The majority of people with light work and occasional lifting return to work 1 to 2 weeks after their procedure. If your work is heavier, involving frequent heavy lifting, pushing, pulling, strong grip on hand tools, or heavy impact through the palm, you may wish to take 4 to 6 weeks. Now that we're through the frequently asked questions, I'll go through more detail about each phase of care. We're going to begin with the days leading up to surgery. I recommend having 2 ice packs available. I also recommend large Band-Aids to cover the surgical site when your operative dressing is removed. Some people may wish to prepare meals in advance so that you're covered for the first 3 days after surgery and can avoid lifting heavy pots and pans, using a knife, or opening tight jars. Choose clothing for the day of surgery that's easy to put on when your hand and fingers may still be numb. This includes pants with an elastic waistband, shirts with large sleeves, avoid sweatshirts with a tight wristband, and slip-on shoes without laces that you have to pull. There are multiple techniques used to perform carpal tunnel release. The most common elected procedure from our patients is an endoscopic carpal tunnel release, which can now be performed with dissolvable sutures which are buried beneath the skin. You'll have a small bandage called a steri-strip, which is directly over the incision for additional reinforcement. And then you have a waterproof bandage that goes over the top of that. The waterproof bandage will be used for the first 3 days. As implied, you can get the bandage wet. No need to cover your hand for showers. After the 3rd day, remove the bandage, leave the steri-strip in place if it's still adherent, and then you can get the hand and fingers directly wet in the shower or for washing your hands, but we ask that you don't submerge the hand in a hot tub, pool, lake water, or even dirty dishwater for 2 weeks after surgery. If your sutures are not absorbable, typically black or blue in color, the same care recommendations can be followed. Keep everything dry for the first 3 days after surgery, then you can get the site wet, but no soaking for 2 weeks. You'll come into the clinic about 10 to 16 days after surgery to have these sutures removed. The steri-strips, if applied, will fall off on their own. Most patients discontinue the large Band-Aid 2 weeks after surgery. At this time, you can begin applying a non-medicated lotion or cream directly to the incision and massaging it gently in a circular motion 1 to 2 times a day. I recommend doing this for 2 months after surgery. You can also apply the silicone scar pad that you receive in the office or can purchase one over the counter at the drugstore. We recommend applying this directly to the incision itself for 1 month after surgery. You'll wear it at night when you're sleeping, and it doesn't need to be worn during the day. This helps to soften the scar. Moving the fingers immediately after surgery helps to reduce swelling and stiffness. Here are some exercises that you can perform with the hand in an elevated position to help get the fingers moving again. Start low and go slow. Expect to have some pulling and soreness. Some people complain of weakness after surgery, and some don't miss a beat. The process is different for everyone, but generally resuming your activities will help you to regain your strength. Begin the strengthening process 4 to 5 days after surgery by using the soft sponges provided to you prior to surgery in the clinic. Alternatively, you can use a soft ball or Play-Doh. Follow-up is easy with our virtual option. Those who elect endoscopic carpal tunnel release with dissolvable sutures will receive a call from the surgical nurse 5 to 8 days after surgery. Then you'll receive a call from the doctor 3 weeks after surgery. These will be your 2 virtual check-ins. If you have sutures that need to be removed, you'll come back to the clinic anywhere from 10 to 16 days after surgery to have the sutures removed. And then your final check would occur between 4 and 6 weeks after surgery, either in the clinic or virtually per your preference. Thank you for taking the time to view this video. Your health is important to us, and we appreciate that you've chosen our team for your health care.